That would be great. Love to do that.
The locations in the United States.
But here in Massachusetts?
I'm not sure. Might be one in Florida, but there's a positive of that.
Hello, everybody. Wow, you guys are so good. Usually it's like, you gotta tap the glass, you know. My name's Keith Hovan. I'm the President and Chief Executive of Southcoast Health. I want to just welcome you all here today. This is an opportunity to celebrate with 31 community organizations that have received some form of a grant from our Southcoast Community Health Benefits Impact Opportunity Program. I had to look down because that was a mouthful. We established this program back in 2015, and the intention of the program was to support and work with, maybe better work with, our community partners who are aligned with us in the mission of making our communities healthier, making this a better place for families, a better place for people to live. And let me start by saying thank you to all of you for all that you do for everybody living in the communities that we serve, especially those who are sometimes under the most challenging of circumstances. So during our first 2 years, the program has now awarded 52 community impact grants, totaling a little bit more than $250,000. And we hope to continue this and see that number grow year over year. But that actually represents a small fraction of the community benefit dollars that Southcoast deploys each and every year within our region. So in the past decade, when we think about the charitable care that we deliver, when we think about the other support services that we provide directly to patients who have no ability to pay or an inability to pay for some aspect of their care, that number actually totals over $200 million in the past 10 years. So it's our job as a not-for-profit healthcare system to not just improve but safeguard the health and wellness of the communities that we jointly serve. So that's what this is really about. It's continuing to work together to drive that home. Now, we work collaboratively with many community partners, and we're very happy to support your work in through our new grant process. This grant process is based on a comprehensive community benefit assessment that we perform for the Southcoast region on a regular basis. So we look at health disparities, we look at the needs of our communities, we look at the incidence rates of smoking, of teenage pregnancy, of low birth weight babies, of all the factors that affect the health and wellness of people that live in our communities. And we use that to help guide the process as our committee meets to deliberate on how to distribute those otherwise those scarce dollars. And this year funded initiatives are ranging from laundry services that are provided to homeless and low-income families, outreach and coordination of care programs for those who are entangled in the opioid crisis that our state is struggling with. And as many of you know, our governor is now going to take a leadership role in Washington on a committee that's looking at this on a national basis. Some of our projects promote wellness by promoting opportunities for healthy eating, wellness through improved physical activity, while others will help families who are dealing with individuals who have memory challenges. The full list of the programs that are supported can be found on the table right by Mr. Kohana. So as you're leaving today, and after you've had a chance to spend some time with your friends and colleagues from other organizations, there'll be a lot of handshaking. So there's hand sanitizer for you. And you can pick up a list of the entire awardees. At this point, I'd like to invite my friend Michelle Loranger. Michelle is, I think everybody knows, is the Executive Director for the Children's Advocacy Center. She's a member of our Southcoast Benefits Committee. And Michelle.
Thank you very much, Keith. As a leader of a local nonprofit, I always thought that one of the coolest jobs, other than mine, in leading a nonprofit was those folks that had the role of handing out money, you know, like from, right? And I kind of get to be a little bit a part of that today, so thank you. I come to you today in 3 different roles: as a community benefits committee member at Southcoast Health, and as someone who was part of the RFP grant review, and also as a member, as I just mentioned, or a leader of a nonprofit who has benefited from Southcoast Health's generosity in the past. So I come from you to you in those 3 capacities. South Coast Community Benefits Committee is charged with knowing what the need is in the areas where they serve, and Keith spoke a little bit about that. This is accomplished by scientific methods and by many of you who have had the occasion to sit and meet with Rachel or Kerry as part of their assessment for the needs. As a community representative on these committees, we work really, really hard to help South Coast assess what is needed most and how they can best work with community partners like yourself to improve health of all of our residents, particularly those that are vulnerable. As a member of the RFP Review Committee for the past 2 years, I get to see firsthand the creativity that all of you produce and the well thought out proposals aimed at addressing those community benefit needs. This allows us to be familiar with the community health benefits, make it familiar with the community health benefits plan, and the RFP process can better align the work that you're all doing with the goals and objectives that we establish as part of the South Coast Community Benefits Plan. So when we set goals together and work collaboratively, we see great results. Last year's grant recipients have really demonstrated, and Kerry gets to share with us the visits that she's done and see all the great work that you're doing with the support from the South Coast Health Community Benefits dollars. And I just want to reiterate, I've learned a lot in the many years that I've sat on the Community Benefits Committee about just how much South Coast Health is doing, not only in their RFP grant process, but in the free care that they're providing. It's really phenomenal. And we anticipate a lot more great work as we go forward. Before I hand this over to another community benefits colleague, I want to personally thank all of you for your great work as well, for making a difference in the health and well-being for people in the South Coast area. But it's really South Coast Health that has made a commitment to improving the lives of people through their generosity and their mission more than medicine. If this doesn't epitomize more than medicine today, nothing does. So thank you to them for all of their support and all of the work that we are doing in the nonprofit world and in the nonprofit work in Fall River and New Bedford and Wareham. So now I'd like to introduce Reverend David Lima, Executive Director of the Interchurch Council of Greater New Bedford, and he'll talk to you a little bit about the opioid work that is happening in his world.
So following Michelle is always dangerous. She's one of the strongest people in our community. I came in with no ribbon. I now have a ribbon. There is no excuse for child abuse. That's something we all need to be aware of, and that's the work that you do, and we thank you for that work. But as Michelle said, and I do want to echo the thanks in this room, not only to South Coast Hospital Group, but to all of you who do so much. The nonprofit world is truly that, nonprofit. In fact, sometimes I wonder if it shouldn't change the name to less than profit, you know, the red zone, you know. A lot of the work that gets done doesn't get done because there's money in it. A lot of the work gets done because there's a need that people see, they recognize, and they're stepping up. Nobody gets into the nonprofit social service work because of the dollar. They get into it because of the need. They get into it because they see difficulties in our communities. And that's why being a member of the Community Benefits Committee, and I thank you all for that, I get to see even that much more the work that needs to be done and gets done. The process, though is vigorous in terms of evidence, is exactly that, evidence-based. So you're not just asking for $1 and getting one. You've got to prove that what you're doing is actually being a benefit to the community. We've been blessed for the last 2 years to have a grant given to us for our COPE program, Community Outreach and Advocacy Program. We are actually the group that, with South Coast Hospital's benefits that we get, we go out with the Bedford Police Department, Seven Hills with a drug resource counselor in Paca. We're all a collaborative, and twice a week, and we're about to add a third night, 3 times a week, we go out and visit the homes of people who have overdosed. And we have been training some people in the surrounding towns. We also do that work in Acushnet with the EMTs because we need to reach people where they are. And when we go out, we actually do talk to hopefully the person who had the overdose. Last year, the police in New Bedford responded to over 600 calls. We had over 42 deaths from drug overdose, okay? We're talking about some serious numbers that are not just New Bedford's problems. As it was stated by Keith earlier, this is a national problem, a national shame. I was at a conference that I left to come here today, and even though it was suicide prevention that I was at the conference, half the conversation was around the opiate struggle. And that's what we're trying to do. The program that they helped support, last year DPH interviewed us all to find out what we were doing, and they've created a knock and talk program through the state that they're hoping that other communities will pick up. So the seed money you gave us, the seed money that we were able to work together collaboratively, has benefited not only our community, but is starting to spread across the state. And that's exciting, because again, it may not have even got off the ground without your help. And that's why Southcoast, quite frankly, is one of the leaders in this community in being able to change the way we are able to get things done. And we're so grateful that you're here and the leadership that you guys provide. So thank you very much.
Michelle and Reverend Limo, thank you very much for your comments. That's it. That concludes the speaking portion of our program this afternoon. We really would like you to have the opportunity to meet others who are serving the communities that we all have an interest in promoting and making better than they are today. We hope you stay around for a while, chat with us, and again, my sincerest and humblest thank you for everything that you do. Thank you.
Housekeeping thing, I'm Karen Mello. I'm a cool person who made you all apply for the grant. I promise not to do that again next year. We'll move the deadline up. But we do have your checks. So Rachel, who's sitting over there at the table, before you leave, make sure you stop by and see Rachel. And I also wanted to, Dave and Michelle both talked about our Community Benefits Committee, which we're very fortunate that they're part of. We're always looking for community members to be part of our committee. We meet 6 times a year. It's an important sounding board for us at Southcoast in terms of what are some of the issues in the community, bouncing things off of you. And we'd love for any and all of you to consider being involved in that. We also have a Patient and Family Advisory Council, which is a similar kind of group that advises Southcoast on ways to improve patient care and just make care better for patients. So we'll be sending everyone an email about opportunities to be part of those committees, and hopefully you'll all consider that. And thank you all for coming.
Thank you.